My youngest daughter, Sophie Roy Weber, was a is a beautiful, healthy, energetic, super intelligent, just a wonderful child. At the age of 6, she experienced an aneurysm bursting on her brainstem that was the result of a congenital vein malformation. She was born with it, and we had no idea. And just suddenly one night it burst, and she began convulsing, and we were then set on a very different path from what we expected from this, high-performing ball of energy, the funny little girl that we had had for the first 6 years of her life. When the crisis hit, there was a lot of confusion. The doctors, with any brain injury, it's challenging for the doctors to know what to do, where the damage has happened. In this case, we knew we had access to a source of information who could explain what was happening, what to do about it. And so we went and saw Douglas. We were familiar with him over the years at that point for several readings, including health, so we knew what he was capable of. And when we went to him to ask about Sophie's issues, again, very detailed, microscopic, minute details about what was going on in her body. The blood, the brain fluid, the chemistry, everything was explained in detail. So it was quite remarkable. After a while, the doctors, who were skeptical initially, began asking us, what did the psychic guy tell you? Because he had become, in their minds, and certainly in ours, a reliable resource to determine what was wrong at the time with any given crisis, and there were many crises along the way, and what was the cause, what was happening, and what could be done about it. And we would tell the doctors, and depending on their demeanor or their open-mindedness, they would respond with a test of their own based on what we told them, which almost always was confirming what Douglas had given us in the readings. We spent, 4, 5, or 6 months in the hospital initially, going in and out of crises. She had the initial bleed, she had a secondary bleed, and she had a tube installed in her brain that drains the fluid out because it wouldn't absorb any longer. That blocked and caused even more damage. There were several what should have been fatal incidents. After several of those and drug reactions and all kinds of horrific events, she was sent home palliative. Her breathing was stopping, it was intermittent, and we were given about 5 days before she would pass away. At that point, I went to Douglas and asked for readings. Is there anything else that can be done, or is she ready to leave at this point? And there was a lot of advice that came through, but the main thing was if you do cranial sacral therapy and shiatsu, it will make her comfortable while she decides whether to stay or not, and you'll know in 6 days. So we did that. We had wonderful therapists who came to the house every day, and what happened was the brain fluid had thickened and wouldn't drain. As we did these therapies, it moved away, and she began breathing more and more normally and became out of the crisis that she was in, the extreme edge of death crisis. We then had them change the valve in the tube to drain more easily, and she began speaking. So it was quite a change from a committee of doctors throwing up their hands and saying we don't know what to do, to having a natural therapy adjunct to the allopathic medicine. It's never one or the other, it's a combination. And they were just thrilled to be involved in that recovery from that dire of a circumstance. Today, Sophie is 23 years old, and she is severely disabled due to all of the many incidents that occurred over the years. There have been several blockages of the shunt, and the initial damage was quite extensive. She's able to use her right hand and speak. She can respond in a limited way. Fluent conversation is not possible, but every once in a while she'll surprise you and say something that you didn't think she was capable of. She has a severe scoliosis, which is almost the main problem, because the twisting in the spine causes the majority of her discomfort and naturally pinches off a lot of the nerve and blood flow and can lead to seizures and whatnot. She is, however, more stable now than she's been for many years. And that seemed to be our role or our path, as Douglas described it, was finding the way, finding the path, beating the path through the bush for others to follow, and determining how do we use natural remedies when they're appropriate, when do we need surgery. We were the ones who made those decisions, my wife and I.